We're following up on a question we asked the province on Friday. Why isn't Ontario collecting race-based data during this public health crisis to understand how racialized communities are being impacted by COVID-19? It's something medical experts have been asking for years, but now with the pandemic here, these calls are getting louder.
We know scientifically that the virus will not discriminate according to race, gender, economic status. But we do know that there are certain populations that are more at risk because we have statistics.
Medical centers like the Black Creek Community Health Centre in the northeast end of Toronto have already been collecting race-based data themselves.
We know that there are inequities around access to health care, particularly for racialized populations.
The data collected shows that certain racialized communities face barriers in accessing health care, have had negative experiences that lead to less frequent visits to the doctors, and some populations are disproportionately impacted by specific diseases. For example, for Black people, there's HIV and a slew of stress-based illnesses like heart disease and diabetes, illnesses that leave them at higher risk of contracting and dying from COVID-19.
We may flatten the curve overall, but in certain communities, that curve will continue to rise if we don't do some targeted interventions. And the only way to do that is to have good data to back us up.
Meanwhile, down south, a number of states are already collecting race-based data relating to COVID-19. The numbers are showing a troubling trend in some areas, including New York, where African Americans and Hispanics account for 62% of the deaths. Experts fear the numbers will be just as bad in Canada.
I suspect that those populations who have unequal access to health care may show us that the Black population and other similarly disenfranchised populations may have higher incidence of COVID, and not only incidence of positive tests, but a higher incidence perhaps of fatality.
Health officials have said there's no evidence that any particular race or community carries a higher risk of getting the coronavirus. Canada doesn't require provinces and territories to collect race-based data. We asked Health Canada why, and we're told to instead contact provincial reps for comment. Ontario's premier says they're not collecting this disaggregated data and are only looking at postal codes.
We do have a map that shows us where some of the hot spots are throughout the province, and we're redeploying the resources needed in those areas, but also communication, making sure that if we see a tremendous amount of cases in one area, we have to pick up the communication.
Experts say if we don't collect the data, then how do we know how communities are being impacted by the virus and the most effective way of responding, not just when it comes to health, but socially and economically?
We support data collection for many different communities, not only the Black communities, but because we have the evidence from other parts of the world that this is happening, why don't we do it?